So if you're a cat owner, this is probably a scene you've dreaded. Your cat is straining in the litter box, or maybe there are accidents on the rug, and your first thought? It's got to be a UTI. But what if I told you that in most cases, that's actually wrong? Today, we're going to unpack the real mystery behind feline urinary issues.
You know, a cat in pain can't just come out and say it. They have to show us. They send out these urgent, sometimes really confusing signals that we, as their humans, have to try and decode. And when it comes to urinary problems, those signals can be genuinely alarming.
And these symptoms, they paint a really clear picture of distress. Maybe you're seeing them rush to the litter box over and over again, but almost nothing comes out. Or you hear that heartbreaking, painful meow. And of course, the one that's so upsetting, finding an accident where it shouldn't be. It's so important to remember, this isn't your cat being bad. This is a cat desperately crying out for help.
All right, so here's our game plan. We're going to start by decoding your cat's message. Then we'll hunt down the real culprit, which is something called FLUTD. We'll see how vets investigate the case, and then we'll get into the right treatments and, most importantly, how you can help prevent it.
Okay, so you see those signs and your brain just screams, UTI, right? But here is the single most important thing I want you to take away today. For most cats, especially younger ones, it's almost never a simple infection. The reality is, well, it's a lot more complicated. Vets have a name for this whole mess, FLUTD. That stands for feline lower urinary tract disease. And honestly, the best way to picture it is as a giant umbrella. All those symptoms we just talked about, they're all huddled under this one umbrella. But the actual cause raining down on them can be totally different. Sure, it could be an infection, but it could also be bladder stones, or inflammation without infection, or even just stress.
And wow, this chart just lays it all out, doesn't it? Look at that! The biggest piece of the pie, a whopping 60%, is something called feline idiopathic cystitis, or FIC. Now, idiopathic is just a fancy way vets say, we're not 100% sure what causes it, but we know it is super tightly linked to stress. Then you've got bladder stones and crystals, and look how tiny that slice for actual bacterial infections is.
In fact, get this. This is a mind-blowing statistic from a major clinical review. For cats under the age of 10, the rate of true confirmed bacterial UTIs is less than 3%. It's definitely more common in older cats, sure, but for most younger cats showing these signs, bacteria just isn't the bad guy. And this is so important because it changes everything about how we should approach treatment.
Okay, so let's talk about another big one under that umbrella, bladder stones. Just imagine you're adding salt to a glass of water. A little bit dissolves, no problem. But if you keep pouring it in, eventually it just piles up at the bottom, right? Well, the exact same thing can happen inside a cat's bladder if their urine gets too concentrated with minerals. And that buildup creates these incredibly painful, irritating stones.
And here's where it gets even trickier. The two most common types of these stones are basically opposites. On one hand, you've got Struvite stones. They form an alkaline or non-acidic urine. And here's the really great news. They can often be dissolved with a special prescription diet. But on the other hand, you have calcium oxalate stones. They form in acidic urine, and, this is key, they cannot be dissolved. The only way to get those out is with surgery. You can see now why getting the right diagnosis is absolutely not negotiable.
So how on earth does a veterinarian figure all this out? How do they know which of these culprits is hiding under that big FLTD umbrella? Well, it's kind of like being a detective, you know? They have to gather all the clues to solve the case and find out what's really going on. And that investigation is a real step-by-step process. It always starts with you. What you've seen at home is the first and maybe most important clue. Next up, the urinalysis. This thing is like a gold mine of information. It can show signs of blood, crystals, bacteria, and tell the vet how concentrated the urine is. If stones are a possibility, then imaging like an X-ray or an ultrasound lets the vet literally see inside the bladder. And only then, if bacteria are still a suspect, a culture is done to prove it's there and to figure out the exact right weapon to fight it. Okay, so once all that detective work is done and the real culprit is unmasked, then the treatment can be perfectly tailored to that specific problem. And this is exactly why just jumping to conclusions and asking for antibiotics can be a waste of time or, in some cases, even harmful. And hey, don't just take my word for it. The International Society for Companion Animal Infectious Diseases, we're talking a global authority on this stuff, is crystal clear. They say that giving antibiotics should only be based on the results of a urine culture. It should be a direct, targeted response, not just a guess based on symptoms. This is how we avoid overusing antibiotics and creating superbugs.
So here's how it all clicks into place, right? The treatment absolutely has to match the diagnosis. Is it a true infection? Then you use targeted antibiotics. Struvite stones, a special dissolving diet. Oxalate stones, that means surgery. And for FIC, the #1 cause, the best medicine isn't a pill at all. It's lowering stress and upping their water intake. And I have to say this, if your cat cannot urinate at all, that's a blockage. This is not a wait-and-see situation. This is a life-threatening emergency that needs immediate vet care.
All right, we have really dug into the problem. But now for my favorite part, the most empowering part, really. Let's talk about how you can help prevent this from ever happening again or even in the first place. Let's build our blueprint for prevention.
And honestly, it pretty much boils down to 4 key strategies. Just 4 simple but really powerful pillars you can build to support your cat's urinary health for their whole life. Let's break them down.
Number 1, and this is the big one, hydration. Water, water, and more water. Cats naturally just aren't big drinkers, but a dilute urine is a healthy urine. It's way less likely to form those nasty crystals, and it helps flush everything out. A water fountain can be a game changer, and adding wet food to their diet, it's one of the single best things you can do to get more water into them.
All right, pillar number 2, smart nutrition. A high-quality, balanced diet is always the foundation of good health. But for a cat that's had urinary problems before, a prescription urinary diet is the single most effective tool we have. Think of it like an insurance policy. It's scientifically designed to manage the urine pH and minerals to stop stones before they even think about starting.
Number 3, and this one ties right back to that FIC we talked about, the #1 cause of all this. Since stress is such a huge trigger, creating a calm home is literally a form of medicine. This means making sure they have safe places to hide, getting in that daily interactive playtime, and keeping their routines nice and predictable. A happy, secure cat is so often a healthy cat.
And last but not least, number 4, the litter box. I know, not glamorous, but so important. A dirty or hard-to-get-to litter box can make a cat hold it, and that leads to that super concentrated urine we want to avoid. The golden rule here is N+1. That means 1 box for each cat in your house, plus 1 extra. Scoop them every day and put them in quiet spots where your cat feels safe. It's a simple thing that makes a huge difference. Phew, okay, we have covered a ton of ground, but I want to leave you with this one last really crucial thought. Sometimes a low-grade bacterial issue can be present in a cat's urine without causing any symptoms at all. Your cat could look and act perfectly fine, but a problem could be silently brewing. It's a really powerful reminder that proactive care and regular vet checkups, they're not just for when our pets are sick. They are our absolute best tools for keeping them healthy from the inside out.